Good morning, classmates and colleagues. I apologize for my absence. My name is Zach Mayer, and I'm going to be talking to you today about West Nile virus and the epidemiology of this infectious disease. West Nile virus is one of many pathogens belonging to the genus Flavivirus. It is important to note that due to the testing method, which relies on antibody responses, it is impossible at this time to fully differentiate West Nile virus from St. Louis encephalitis, which is also found in the U.S. However, for the purpose of our discussion, I will generically refer to West Nile. The vector most responsible for the transmission of the West Nile virus is, of course, the mosquito. In the U.S., it is specifically the common house mosquito, the Culex, which is known to thrive in urban areas. The first ever recognized case of the virus was isolated from the blood of a febrile woman in the West Nile district of Uganda. Since then, West Nile virus has been described in other regions of Africa, Europe, the Middle East, West and Central Asia, Oceania, where it is the subtype called Kunjin, and most recently North America. It has been reported in all U.S. states, with the exception of Hawaii, Alaska, and Maine. Approximately 80% of people who are infected with West Nile virus will be asymptomatic, though 20% of people who become infected will have mild symptoms such as fever, headache, body aches, nausea, vomiting, and sometimes swollen lymph glands or a skin rash on the chest, stomach, and back. Symptoms can last for as short as a few days, though even healthy people have become sick for several weeks. About 1 in 150 people infected with West Nile virus will develop a severe form of the illness. Severe West Nile comes in the form of either West Nile encephalitis or West Nile meningitis, which is the swelling of the brain and the inflammation of the membranes around the brain and spinal cord respectively. Severe symptoms can include high fever, headache, neck stiffness, stupor, disorientation, coma, tremors, convulsions, muscle weakness, vision loss, numbness, and even paralysis. These symptoms may last several weeks, and neurological effects may be permanent. Of the 1% of the population that develops severe symptoms, approximately 10% will die. West Nile virus, if symptomatic, will begin to show effects 3 to 14 days after the infected vector bite. Unfortunately, there are no treatments at this time. If a case is severe, then hospitalization will likely be required. Here the patient is provided with fluids, breathing help, and other supportive therapies. The most obvious risk factor for West Nile virus is, of course, exposure to mosquitoes. However, beyond this, we know that people over the age of 50 are the most at risk of developing severe symptoms, and that the risk is greater with each subsequent year of life. There is also a minor risk of transmission through blood and organ transfers, though thankfully the U.S. began mandatory screening for the virus in July of 2003. It is also interesting to note that there has been at least one reported case of the virus being transmitted through a mother's breast milk. This, however, is of course nowhere near enough of a sample to draw any legitimate conclusions. West Nile is adapted to transmit and thrive via bird and mosquito populations. Although it is able to transmit to mammals, it is not known to be at infective levels. Furthermore, there is no evidence of a mammal-to-mammal transmission. Ergo, humans and their mammal relatives are likely incidental or dead-end hosts that do not serve to propagate the virus. Just as an interesting aside here, there was recently approved an equine vaccine, as horses have a much greater mortality rate associated with the virus. We'll now watch a short video brought to us by the CDC. If somebody would please take the time to pause this video and follow the link provided. Thank you. Lastly, a note on prevention. The best way of avoiding West Nile virus is to subscribe to the 4 Ds, which is, of course, dusk to dawn, staying indoors from dusk to dawn, times when those mosquitoes likely to carry the infection are most active; dress, which is to say you should dress in pants and long sleeves when you are outside, especially in mosquito-infested areas. Third D stands for DEET, or DEET, which is to say that you should use insect repellent containing this particular chemical, and you should spray both exposed skin and clothing with the repellent. Lastly is drain, getting rid of standing water in your yard and neighborhood. Old tires, flower pots, clogged rain gutters, leaky pipes and faucets, bird baths, and wading pools can be breeding grounds for mosquitoes. As a last note, as you heard in the video from the CDC, they would appreciate the reporting of all dead birds to your local health officials for the purpose of tracking. Thank you very much for your time. And I will now leave you with the decision to applaud for the recorded voice or not.